Your doctor has prescribed an AeroChamber Plus FlowView anti-static valved holding chamber with small or medium comfort seal mask for treatment of your child's respiratory needs. AeroChamber Plus FlowView anti-static valved holding chamber carries on the over 25-year AeroChamber legacy of quality and brand performance. It has also been enhanced with several other significant features to ensure maximum effectiveness and provide additional peace of mind for both patients and caregivers.
Let's start by talking about why your child needs a metered dose inhaler, or MDI. MDIs are medication delivery devices used by people for a variety of breathing disorders. If your child has difficulty breathing, it's usually because not enough air is getting into and out of their lungs. Children with healthy lungs are able to breathe in and out normally, obtaining the amount of air needed by the body. With some children, air can't always move in and out of the lungs easily. This condition could be the result of the narrowing of the tubes that leads to the lungs. This could be caused by swelling inside the tubes, contraction of the muscles that encircle the tubes, or accumulation of mucus within the tubes. The medicine in your child's MDI helps them overcome their breathing problems. While some medications are used to provide fast relief of breathing difficulties, other medications are used for long-term preventative reasons. Your physician will instruct you on how often your child should use the MDI and the AeroChamber Plus FlowView AVHC. It's important to follow only the orders or advice of your child's physician or other healthcare provider. They, along with this video, will show you and your child the proper way to use an MDI and AeroChamber Plus FlowView AVHC. Your child's MDI is made up of two components, the canister and its plastic boot. The medication is in the canister, which is placed inside the plastic boot. When the canister is depressed, the MDI releases a spray puff containing measured amounts of medication. Your physician will prescribe the number of puffs that's right for your child. The AeroChamber Plus FlowView AVHC is an aerosol delivery device designed to work with your child's MDI to make the medication delivery even more effective. The AeroChamber Plus FlowView AVHC will make it easier for your child to use the MDI and will maximize the delivery of medication to their lungs. This is done by separating the smaller particles of the medication from the larger particles. The smaller particles flow easily to the affected area of the lungs. The larger particles, which can cause throat irritation, cough, and infection, remain in the chamber. The chamber holds the smaller particles of the medication until they're inhaled into your child's lungs. The one-way valve located near the front of the AeroChamber Plus FlowView AVHC opens, allowing the medication to flow into your child's lungs as they breathe in, but will not let them exhale breath back into the chamber as they breathe out. This feature allows your child to take more than one breath as the medication is held in the chamber, so you're confident your child is getting the maximum amount of medication into their lungs. The clear chamber allows you to see the medication from the inhaler enter the chamber. The AeroChamber Plus FlowView AVHC with FlowView Inspiratory Flow Indicator in small and medium masks is an indispensable tool that caregivers can use to visualize how to actuate the pressurized metered dose inhaler in conjunction with their patient's inspiratory maneuver. When the FlowView Inspiratory Flow Indicator moves from the vertical position towards the patient is inhaling. As the patient stops inhaling or exhales, the FlowView Inspiratory Flow Indicator returns to the vertical position. Another feature of the AeroChamber Plus FlowView AVHC is its clear, anti-static chamber. Unlike static-prone chambers in which static-charged aerosol particles are attracted to the walls of the chamber, the AeroChamber Plus FlowView AVHC minimizes static charge and, in turn, increases aerosol suspension time for up to 10 or more seconds after the pressurized meter-dose inhaler, also known as an MDI, is actuated.
Other important features of the AeroChamber Plus FlowView AVHC include Easy Flow Exhalation Valve. The integrated exhalation valve minimizes rebreathing and directs exhaled flow away from the patient's face. Comfort Seal Mask. The Comfort Seal mask is made of a soft, pliable material for a snug fit and secure seal, limiting entrainment of ambient air and maximizing drug delivery. Flow Dynamic Valve and Baffle System prevents patients from exhaling into the chamber so that the remaining medication is available for the next breath. Universal Backpiece fits commonly prescribed MDIs for easy insertion and removal. Easier to clean. The AeroChamber Plus FlowView AVHC take-apart design is dishwasher safe. Small, portable chamber. The AeroChamber Plus FlowView AVHC is the ideal size for clinical effectiveness and people on the go. It's important to remember that the AeroChamber Plus FlowView AVHC must be used consistently, correctly, and in a manner that your child will accept, so that the medication process is fun and beneficial to your child's breathing.
Let's go over a few suggestions to make sure your child enjoys using the AeroChamber Plus FlowView AVHC. When using the AeroChamber Plus FlowView AVHC, you can gain your child's trust and overall cooperation by never forcing the mask on your child or attempting to treat while your child is crying. Make sure to give lots of praise and rewards in a soothing, encouraging voice when your child is using the chamber correctly. Practice short treatments by having the mask near your child's face. You can also use teddy bears, dolls, or even adults to pretend to use the chamber and make it look like a game. Or, with adult supervision, just let your child play with the chamber while offering encouragement. Just remember not to leave the chamber unattended with a child. Other ways to make sure they get their medication might mean giving them the treatment when they're happy or even when they're sleeping. The last tip I have for you today is to let your child have some stickers to decorate the chamber and make it their own. Let's take another look at those tips that will help you and your child make treatment fun.
The AeroChamber Plus FlowView anti-static valved holding chamber with small and medium comfort seal mask was designed specifically for children. The following instructions will help you to treat your child effectively, so you ensure all of the medicine your child needs gets to the right place, their lungs.
This is my son Tyler, and like most kids, he is so ready to play and full of energy. But like more than 5 million other children in the US, he suffers from chronic asthma. But I don't ever have any problem making sure he takes his medicine because I have the AeroChamber Plus FlowView Anti-Static Valved Holding Chamber, or AVHC. He knows that the AeroChamber Plus FlowView AVHC will bring quick relief, and so do I. First, I take off the cap, then shake the MDI to activate the contents, and insert it into the back piece of the chamber. Then I place the mask on his face and I look closely to see that there's a tight seal around his mouth and nose. Now I can see if there's a tight seal simply by looking directly at the FlowView inspiratory flow indicator and watch it move back and forth. Then I depress the top of the MDI, like so, and it releases the medication into the chamber. I count for 6 breaths by watching the FlowView inspiratory flow indicator. Then I wait about 30 to 60 seconds in between depressions and then administer another puff based on our doctor's instructions, being sure to only administer 1 puff at a time. Asthma and respiratory illnesses can certainly be difficult, but with the AeroChamber Plus FlowView AVHC, not only do I have assurance that I have the right tools to treat him, but I also know he's getting his medicine to the right place.
The AeroChamber Plus FlowView anti-static valved holding chamber can be used right out of the package and then cleaned weekly. An instructional insert is also included in the chamber package. The AeroChamber Plus FlowView AVHC is made of durable anti-static material and has a one-way valve. With repeated use, residue may accumulate inside the chamber and around the valve. This may eventually interfere with the effectiveness of the chamber. Let's take a moment to review the cleaning instructions for the AeroChamber Plus FlowView AVHC. Remove the back piece. To detach the front piece, simply twist the chamber as shown. Soak the parts for 15 minutes in a mild solution of liquid dish detergent and lukewarm clean water. Shake gently, then rinse the parts in clean water. Shake out the excess water from the parts and allow to air dry in a vertical position. Ensure the parts are completely dry before reassembly. The AeroChamber Plus FlowView AVHC is also dishwasher safe. Place the parts in the top rack of the dishwasher and ensure the product is securely placed face up as shown. Be sure to use a dishwasher detergent and a rinse aid. Remove from the dishwasher when completed. Shake out the excess water from the parts and allow to air dry in a vertical position. Ensure the parts are completely dry before reassembly. To reassemble, fit the front piece on the end of the chamber and twist firmly until securely locked into position. Center the alignment feature on the back piece with the FlowView inspiratory flow indicator as shown. Press firmly to attach the back piece. Examine your child's AeroChamber Plus FlowView AVHC visually before and after cleaning to make sure all parts are properly secured. Your child's chamber should be visually inspected before and after daily use. You may need to replace the AeroChamber Plus FlowView AVHC after 12 months of use.
As you've seen here, both the MDI and the AeroChamber Plus FlowView AVHC are specifically designed to help your child get the medication they need to their lungs. The metered dose inhaler, along with the AeroChamber Plus FlowView AVHC, should become a part of your child's everyday routine. The AeroChamber Plus FlowView AVHC is a unique device designed to aid your child in effectively delivering their medication.
This video included instructions to assist in using the AeroChamber Plus FlowView AVHC with small or medium comfort seal mask. Rest assured that the AeroChamber Plus FlowView AVHC will provide the relief your child needs and give you and your child more time to breathe easy. Please remember to read the complete instructions included with the AeroChamber Plus FlowView AVHC in addition to watching this video. Monaghan Medical Corporation has a full line of respiratory products that include valved holding chambers such as the AeroChamber Plus FlowView AVHC with mouthpiece, ideal for older, more coordinated children and adults, and the AeroChamber Plus FlowView AVHC with large comfort seal mask for patients who cannot form a sufficient mouthpiece seal or may still have trouble coordinating. It's important for you to follow the instructions given to you by your physician or licensed healthcare professional, as discussed in this video. Thank you for using the AeroChamber Plus FlowView Anti-Static Valved Holding Chamber.